our easy visit screening, we are now over 8,200, 8,245. It's resulted in 2,158 easy visits, and the COVID promo code was used by 997 people. Our daily census, we're at 345. John will elaborate a little bit more, but the numbers are going up as happens in this curve. Our drive-through clinic, we have tested 580 patients with 15 positives, 465 negatives, and 100 pending. At Bryan Medical Center, we now have 6 positives, 142 negatives, 40 are pending. 10 of those are in patients here at Bryan. In our respiratory walk-up clinic at urgent care that Sarah talked to you about last week, we have tested 89 with 3 positives, 67 pending. 67 negative and 19 pending. So John will share the totals, but it's been more than a 100% increase since we talked to you on Friday. With that, I'm going to ask John to come up and address some things, and then we'll have Mike.
Thanks, Bob. I'm John Woodrich, CEO of Bryan Medical Center. So I wanted to give you an update on the totals. So as Bob shared with you those numbers, we have now tested 857 people for the COVID-19. We have 24 positives, 674 negatives, and 159 still pending. I do want to make comment that we have been working with the third-party lab and have had a lot of results returned this weekend. I think last week we reported over 300 pending just through the drive-through, and that's down to 100. So we're making some really good progress on getting that turnaround to occur quicker. And what they're doing is they're sending some of our samples to another lab at a different location in the United States. I did want to also comment that when we track these numbers, we do it based on the location where the test was administered at. So we could have done a test at the urgent care center and then the person comes to the hospital later. We will count that if they are positive at the urgent care center or at the drive-through so that we don't double count numbers. That's our easiest way of keeping track of numbers and giving you reliable information. Did want to comment that our valet service, as we mentioned last Friday, that was the last day. So if any individuals are coming to our East Campus, there is no longer a valet service, and this is for the safety of those individuals. Wanted to comment that visitor policy went into effect, and I want to thank the community. We have been very compliant as a community to following the directions about the visitors and who can have them. And as we stated before, we basically have a no visitor policy, but have some exceptions for our birthing center and for children. Wanted to also comment on the surge plan. We continue to work with our health department. We're now working on different tiers as volume picks up, how we will handle the volumes, and we're working with even our critical access hospitals to maybe handle some of our less severe patients so that we can continue to service not just the community of Lincoln, but the region that includes most of western Nebraska. With that, I'm going to turn it over to Mike Dixon.
Good morning. I'm Mike Dixon. I'm Director of Nutrition and Dining Services for Bryan Medical Center. I've worked at Bryan for a little over 25 years. I was asked to come in and speak today. We've had some questions. We have some semi-trailers that we have parked, one at East Campus and one at West Campus, and that has resulted in some inquiries from our staff and then also from the public. Those trailers are additional storage for nutrition and dining services operations. We have secured extra food supplies so that we could have those on hand during the pandemic crisis. One reason is to limit the number of folks that are coming to the medical center for deliveries and limiting the number of people that actually come into our area to help us resupply. And then also to give us an emergency supply in case there is any supply chain disruption. It's one of those circumstances where you hope for the best but make contingency plans in case your expectations aren't met. A little bit about nutrition and dining services. We offer multiple support services to Bryan Medical Center. We help clinicians assess our Bryan Medical Center patients for malnutrition. We also do education for patients on appropriate nutrition and make sure that they get the nutrition that they need to help with their healing process for whatever disease state that they might have. We also supply patient meal service to the patients. And then we also have retail operations where we feed members of the public and then also a number of our staff members. And we track statistics. It's kind of interesting to me, the volume that we produce per year. So last year in 2019, we served over 2.7 million meals at Bryan Medical Center East and West. The pandemic offers challenges to operations in our department, and so we've had to make a number of changes to how we do things to increase safety for our department and then also the staff and patients of Bryan Medical Center. We've increased our cleaning processes and supplied wipes that customers can use along with instructional signage and also media so that they can do hand sanitation. We have eliminated self-serve items in all of our retail operations so that there's less chance of cross-contamination. We've moved items that are considered to be high touch from public access. So things like condiments, for instance, those are behind the counter now, and you can still access those, but one of the NDS staff members performing proper hand hygiene and wearing gloves will dispense those individually so that they're not touched. We've also removed significant amounts of seating so that anyone who wants to eat in our retail areas can and still maintain 6 foot of distance in between each table. We've also recently placed marking guides on the floors with tape so that people waiting in line for service can maintain that social distancing and have a guide mark and know that they're exactly 6 feet apart. We've also stopped the passing of paper from customers to our cash register staff. Things like coupons, reward cards, that sort of thing. And then we have posted signs asking people to consider not using cash. Cash is one of the things that we would like to not have passed back and forth between a customer and our staff members, and we're looking at eliminating cash as a form of payment in the near future. I also wanted to mention that we've been very grateful for the large number of donated items that have been offered from the public. A really amazing amount of folks have come forward and offered things for Bryan Medical Center staff, and those have been greatly appreciated. I wanted to give a special thank you to Runza. We were reached out by the Vice President of Runza National, Renee Shilin. Okay, I wondered if I was going to get that pronounced correctly. Apologies. And we will be receiving over 6,000 cinnamon rolls from Runza this week that we will figure out how to creatively deploy to our Bryan Medical Center employees as a thank you for the hard and difficult work that they're doing right now.
No, we really aren't. And I think a couple of things that has been put in place, the walk-up respiratory clinic and the drive-through clinic has really minimized the people coming with potential COVID symptoms to the ED, and otherwise it has been normal ED traffic for the most part.
We are trying to get results back as quickly as we can. In working with our third-party lab, there were some patients that it was taking so long. That's when we made contact with their administration and were able to get tests sent to another location. So we did ask those patients to come in if they wanted to get a faster turnaround, and some of them took advantage of that, and we got those results back more quickly. We understand that people are awfully anxious to get these results back, so that was a way of accommodating those specific situations. We currently have about 138 ventilators, and we have a plan in place that if we had to convert more rooms to be ICU rooms, we can utilize all 138 ventilators. So that's the capabilities that we have. Currently, I don't know how many of the COVID inpatients are on ventilators, but we can find out that information. I believe we have 3 COVID patients in-house, another 10 that are pending results. So we have a specific unit, an isolation unit for those individuals until we get those results back. I don't have the detail of that as we were getting results throughout the weekend. I will tell you, going into the weekend, we only had one that was from outside of our county, but we'll get more information on that and report that in the future to you as well. I think we're ahead of the game right now in preparation for the surge. So we have 4 complete units done and are continuing to work on additional units that we can have converted should our surge happen here within the next few weeks. We do have the capabilities. Again, we're just waiting on getting the reagents. We're going through a few different sources to try to get those available to us. We actually have a Heartland Health Alliance where there's about 50 organizations or other hospitals that partner with us. Currently, we're working with our Creed Area Medical Center. We will be working with Wahoo. I know CHI is thinking about Nebraska City, and we're going to reach out to our partners in Seward County. We're trying to get the areas immediately around Lancaster County, so depending on where that patient lives at, we're not asking them to travel long distances and they could have those support systems near them. But again, I always want to mention, we try to get people, if they could, isolate themselves within their home. If their condition warrants that they are to become an inpatient, we want to make sure that we have the capacity to handle any of those that need to be hospitalized. You know, I'm going to leave that up to our officials. You just have to look at results of what's happened in other states. There will be a trigger point, and you know, my own personal opinion, I just think long as we could continue to isolate ourselves and do the social distancing, all of that plays a big impact on flattening this curve and not having as high a surge as what we've witnessed in other communities. That's what we're going to be having those discussions with the critical access hospitals. We have a couple different phases. If we are having a patient that just needs like maybe a skilled type of care, we may utilize the critical access hospitals for that. But depending on the surge, we may be looking at just moving more low acuity type patients to the critical access hospitals and managing them through telemedicine.